بسم الله الرحمن الرحيم. أعزائي طلبة المرحلة الخامسة، السلام عليكم ورحمة الله وبركاته. اليوم المحاضرة الثانية بالنسبة لاختصاص الأذن والأنف والحنجرة. Today's lecture is about the tonsillar disease and tonsillectomy. The learning objective, at the end of this lecture, I want you to know the management of tonsillitis and related subject, the indication and contraindications of tonsillectomy, type of procedures, the procedure, the tonsillectomy, and the post-operative care of patient with tonsillectomy, and the complication of tonsillectomy, especially the hemorrhage. This is a short review about the anatomy. You know that the tonsil is a lymphoid tissue which lies in the oropharynx. It's not in the oral cavity, it is in the oropharynx. لذلك إذا تسألون هل يقع التونسل في الأورال cavity أو بالفارنكس, the answer is in the pharynx, especially it's in the exactly in the oropharynx. This is the soft palate and this is the palatine tonsil. احنا من نقول tonsil, we mean that it is a palatine tonsil. This is the palatoglossal fold and this is the palatopharyngeal fold. اللي هاي يسمونها البالاتوغلوسال يسمونها anterior pillar and this is the posterior pillar. The important information you should know is the blood supply of the tonsil. The blood supply of the tonsil is very important. Why? Because the main complication of tonsillectomy is hemorrhage or bleeding. So we have to know the detail about the blood supply of the tonsil, so that the blood supply of the tonsil comes from the lingual artery, ascend upward, from the maxillary artery through the descending palatine artery and through the ascending pharyngeal artery, which comes to the tonsil, as well as from the facial artery. But the tonsil is very rich organ in blood supply, so that when we remove the tonsil, we must sure that all bleeding will secured. Of tonsillectomy is tonsillectomy to reach another structures, so that as a surgical approach, for example, in eagle disease, we have to reach to the styloid process. In case of glossopharyngeal nerve problem, we have to remove the tonsil and reach the nerve, and so on, so that it is for a surgical approach to another part. Now, in quick, we reviewed the relative indications of tonsillectomy. First one is peritonsillar abscess, single attack, as I said. If there is eating and swallowing disorders, especially in childhood, which may necessitate tonsillectomy, halitosis, bad mouth odor, tonsillolithiasis. عرفتوا الليثياسيس تصير in different part of the body, in case of rheumatic fever, glomerulonephritis, and non-resolving complications of tonsillitis. For example, in case of recurrent acute otitis media, recurrent sinusitis, so that we have to remove the tonsil for get rid of this non-resolved complications. These points are very important in differentiation of the acute tonsillitis, the usual one, and These are the differential diagnosis of acute tonsillitis. You should know these points. Why? To not confuse. Why? Because tonsillitis is a simple and very common disease in childhood as well as in adulthood, but it may mimics a dangerous conditions, for example, agranulocytosis, for example, leukemia, and for example, malignancy. So you have to have an index of in this regard. This is a kissing tonsil, definitely this patient complaining of obstructive sleep apnea, as well as there is follicles, which mean these are also, and this is the membranous tonsillitis. This is the coalescence of the follicles together to form a membrane, and this is malignancy or suspicious of. And now we reach to the subject of tonsillectomy. What is the meaning of tonsillectomy? Tonsillectomy is a surgical procedure to remove the tonsils here according to indications, which are the absolute indications and relative indications to convert to tonsillectomized person. This is the position of patients as well as the surgeon during the tonsillectomy surgery. Now, what are the second one is diathermy. And this is the pants of diathermy tonsillectomy. This is diathermy. This is unipole. This is ultrasound coblation tonsillectomy. And the last one is tonsillectomy by cryosurgery. اللي cryosurgery يستعمل in different field of as I said, this is the displaced uvula because of this is the opening. This is the classical picture of tonsillectomized patient. There is granulation tissue and debris over the bed of tonsils. Now, what are the contraindications? There is no absolute contraindications for tonsillectomy, so that we have to correct these conditions and go forward if there is indications for tonsillectomy, especially absolute indications. These are acute infection. We have to wait to treat the acute infection, and after 3 weeks, say, we have to go forward for tonsillectomy. In blood dyscrasia, for example, hemophilia, we have to correct the deficient factor and then go forward for tonsillectomy. In case of cleft palate, in case of uncontrolled systemic disease, for example, diabetes mellitus and hypertension, heart failure, and so on, and in case of contraceptive pills, so we have to wait 6 weeks before doing the tonsillectomy. In case also in epidemics. Now, if I ask you what are the post-operative care for patient with tonsillectomy, there is immediate general care اللي هي طبعا تعتمد عليكم. ليش؟ لأنه أنتم إن شاء الله السنة اللي وراها تكونون أطباء بردهات اللي راح يطلع لكم المريض من العمليات، من صالة العمليات. You have to care about this patient. So, in case of immediate general care, we have to keep the patient in coma position until full recovery from anesthesia. Secondly, keep a watch on bleeding from the nose and the mouth, because it is a dangerous complication, especially in the first few hours after tonsillectomy. Third, we have to keep check on vital signs. لازم نسوي له chart by the pulse, respiration and pressure. The diet of patient, here this is a controversy about the diet of patient, but in text they say that when patient is fully recovered, he is to take liquids, for example cold milk or ice cream. Sucking of ice cubes give relief from pain. Ice هم هنا شنو يسوي لنا؟ يسوي لنا vasoconstriction as well as relieving of pain. Diet is gradually boiled from soft to solid food. They may take custard, jelly, soft boiled egg, or slices of bread soaked in milk on the second day. Plenty of fluid should be encouraged to prevent hypotension and hypovolemia. And the oral hygiene is very important. Oral hygiene is very important. We have to give the patient analgesics. Pain locally in the throat and refer to ear can be relieved by analgesics like paracetamol. An analgesic can be given half an hour before meals. Antibiotic, a suitable antibiotic can be given orally or by injection for a week. Patients usually sent home 24 hours after operation. Unless there is some complications, patient can resume his normal duty within 2 weeks. Now, we'll talk about the complications. There is a lot of complications. المهم عندكم هو البليدنgs post hemorrhage. The post tonsillectomy bleeding either primary or secondary. Primary also named reactionary. primary or reactionary. لكن اكو يقولون reactionary يختلف عن البرايمري. احنا حتى نسهل المسألة, there is primary or secondary. The primary occur in the first 24 hours. This no. So that the primary within 24 hours of surgery. What are the cause of the primary or reactionary bleeding after tonsillectomy? The first one is formation of blood clot or dislodgement of blood clot from the lumen. Why? Because the blood clot prevent the constrictor muscle to constrict on the bleeding vessels. Second, vasodilatation of blood vessel after operation. Third, postoperative raise in blood pressure. Fourth, increased venous pressure by cuffing or retching. And fifth, which is depend on the surgeon, is slipping of ligature, so that ligature should be very tight. So how you manage reactionary hemorrhage? Any hemorrhage in the body, اتعلموا إذا قالوا لكم what is the treatment or what are the treatment, what is the management, you should say the first aid. You should say the priority for the first aid. Blood is cross-matched, tonsillar fossa is inspected and the clots removed to permit the spear constrictor to constrict on the bleeding vessel. Pressure with a swab soaked with adrenaline. Administration of hemostatic agent, for example, tranexamic acid, and the patient may require taking to operation theater and ligation under general anesthesia, either ligation or cut off bleeding vessel. Why variational or primary bleeding is very, very dangerous? The first cause is that it may be missed. يعني إذا أنت طبيب مقيم بردها وما تاخذ الحذر للمريض اللي مسوي tonsillectomy, may be missed, and it may cause fatal aspiration. لذلك position is very important post-operatively. The large hemorrhage may require ligation or electrocoagulation under general anesthesia. وهنا شنو الخطوة؟ إذا عندنا 2 sessions of general anesthesia in short interval, it becomes so dangerous. لذلك هاي الأسباب of the dangerous bleeding of the tonsillectomy, after tonsillectomy. Now, what is the secondary hemorrhage? Secondary hemorrhage. قبل أن أتحول للسكندري هيموريج، إذا أحد من الطلاب قال ما فات أنا سويت هاي المجر كلها وما فات، شنو راح أسوي؟ هاي أريدكم تبحثون عنها. شنو راح أسوي إذا ما فادت هاي النقاط للمانجمنت of primary post-tonsillectomy bleeding? In case of secondary hemorrhage or secondary post-tonsillectomy bleeding, which occur after 24 hours before the completion of 2 weeks, especially in the first week. The cause here, absolutely, it is infection of the granulating tonsillar bed. So that scientifically the treatment is by broad spectrum antibiotics. treatment خب ما تنطي له treatment وتقول له روح للبيت، لا. The ideally انه تسوي له admission، هم تسوي له المجر، انه تنطي gargle of cold water, for example, by pressure by goes soaked with adrenaline, and also we can give some drugs for cessation of blood if يعني احنا ما نقول if failed, but here the antibiotics is very important. and هنا if failed يعني هاي المجر كلها راحت، كلها سويناها وما فاد المريض، ظل bleeding, so that we have to transfer the patient to theater. هنا شو نسوي؟ لا نسوي ligation ولا نسوي cauterization because the area is necrosed. so that شو نسوي هنا؟ نسوي نحط ghost bag, sterile ghost bag in the tonsillar bed ونخيط ligation أو نخيط الانتيرير على البوستيرير pillar, and this bag, for example, stay for 2-3 days, and then after that يعني والمريض هو عندنا بردها covered with broad spectrum antibiotics. After that we have to remove the stitches and remove this pack. Here the condition may be solved. السؤال الآخر, if the condition is still there is no cessation of bleeding, شنو راح نسوي؟ هذا هم أريدكم. Thank you very much.